Hey everyone, it's your boy KP here from the No Justice, No Peace report. So, the article I'm sharing with you, or the information I'm sharing with you, is coming from the New York Times. Check it out for yourself, and from other news outlets as well. As I've said before, it is there, but we don't want to listen, or we are turning a blind eye to the whole information. COVID-19 and all these vaccines coming out. Everybody's lining up, next man up in terms of coming out with a vaccine. All right, New York Times article. All right. A few COVID vaccine recipients developed a rare blood disorder. Right. A link to the vaccine is not certain, and the investigations are underway in some reported cases. Now, the reason I chose the New York Times is because they said something that I've already highlighted in reporting on the COVID-19 vaccines and the deaths that have occurred. All right, let's see what the New York Times is saying here. One day after receiving her first dose of Moderna's COVID vaccine, Luz Legaspi, 72, notice the ages here, 72, woke up with bruises on her arms and legs and blisters that bled inside her mouth. She was hospitalized in New York City that day, January the 19th, with a severe case of immune thrombocytopenia. I hope I said that word correctly, but when you read it, you can see it for yourself. A lack of platelets, a blood component essential for clotting. The same condition led to the death in January of Dr. Gregory Michael. And there's a link to that story. I mentioned Dr. Gregory Michael and what happened to him. He was 56, an obstetrician in Miami Beach, whose symptoms appeared 3 days after he received the Pfizer-BioNTech vaccine. Treatments failed to restore his palates, and after 2 weeks in the hospital, he died from a brain hemorrhage. I mentioned this story, right? I may not know the terms and what's happening or how to explain them properly, but I know how to read, and I can cite information well. So it is not known whether his blood disorder is related, which is what they always say, to the COVID vaccine. More than 31 million people in the United States have received at least one dose, and 36 similar cases had been reported to the government's Vaccine Adverse Event Reporting System. All right. VAERS, by the end of January, the cases involve either the Pfizer-BioNTech or Moderna vaccine, the only two authorized so far for emergency use in the United States. All right. And I'll put it in the description box. It says officials with the Food and Drug Administration and the Centers for Disease Control and Prevention said that they are looking into the reports, but that so far rates of the condition in vaccinated people did not appear higher than the rates normally found in the US population. So the cases could be coincidental. None of this was happening before, but it is coincidental, right? The vaccines are here, and then all of a sudden it's all coinkydink, right? Overall, the vaccines are considered safe, but yet you've given it an emergency use authorization. Not full authorization, emergency use. A small number of severe allergic reactions have been reported. Small, huh? But they are treatable, and the rates are in line with those reported for other vaccines, regulators say. Money, billions of dollars. You and I, the guinea pigs. The information is there, but we're just not reading it. It's your boy KP. All right. Check the description box. Stay woke. Stay red.